About we block program for resident radio star, Dr. Craig DeLisi. Hey, doctor.
Oh,
How are you?
good. How are you?
I'm doing great. What's going on at the Family Care Center, Titus Regional Medical Center?
Just usual stuff. Just seeing my people.
My peeps. Nice. So when you say usual stuff, what is the topic of the day? If there is a topic that people are coming in and asking you about a lot now, what is it?
There's quite a variety, doing just being a family doc. I mean, obviously I see little bits of just about everything, but probably the thing over the last year or couple years that I spend the most time with, if I had to rank, other than the usual, chronic illnesses like diabetes and high blood pressure and things like that, would be talking about weight and weight loss. I think primarily because of the prevalence of some of the newer weight loss methods, and especially the injections and stuff like that. So talk about that quite a bit with patients. I mean, that's a daily topic with usually one or more people, I would say.
So let's go with that topic then. Let's say I'm going in. I am struggling with weight. I would like to lose weight. I would like to find out about those drugs. They are initially, are they not for treatment of diabetes? And then all of a sudden they realize, wow, people are losing a lot of weight on this stuff. What if somebody's carrying too much weight, they want to lose weight, but they don't have diabetes? How affordable is it?
Yeah, I think that's really the sticking point, because for me, when it comes to what, first of all, I'm always happy when patients are addressing their weight problems, and there's no question. I mean, you don't have to be a physician to tell that we have weight problems in our country. I mean, I think we have, I forget what percentage of the population is either overweight or obese, but I don't know if it approaches 75% or something like that among adults. It's incredible. And so I'm happy, and people try in different ways and struggle. And in the past, we've had medicines that are either, effective and cheap, but maybe not necessarily safe. There's been a lot of weight suppressant or appetite suppressants in the past that I'm not a real big fan of because of effects they can have sort of on the cardiovascular system, and I think they provide a lot of short-term weight loss. And so when these medicines came out for diabetes, which has been for quite a few years, probably 10 years ago, and they've been improved upon in the last, I think, 6 or 7 years to where they're once weekly injections. I've used them a lot in diabetic patients with great success, and one of the mechanisms by which they help, they lower blood sugar by doing some things, but the reason they help with weight loss is because they slow the emptying of they slow digestion a bit and the emptying of the gut so people feel full. And they also sort of help with communication between the stomach and the brain to communicate a sense of fullness, which is something we all have, but many of us sort of push past that enough in our life that we kind of lose the sensation. And especially people who are overweight, and particularly people who are diabetic or pre-diabetic, often really just don't have normal sense of fullness. And so the medicine restores that fairly quickly. And so people, one, they're not hungry nearly as often, and then when they do eat, they much quicker than usual have a sense of satiety, fullness, and then stop eating. In other words, they're able to say, gosh, I don't want to eat anymore. And sometimes it's profound. They'll make a normal plate and can only eat a third of it. And so when you combine those, it starts to have a pretty profound impact on weight. And for diabetic patients in the past, I've had people lose, 60, 70, 80 pounds and sustain that. And so it wasn't a surprise to me that they started marketing these for weight loss. And you're right, though. The question, the problem is
money.
If insurance doesn't cover it, which for most people it doesn't, then they're almost $1,000 a month for the 4 injections. And so I've seen an increase in insurance coverage, which is encouraging. And then there are other ways to get it that aren't through the branded name. They're what we call compounded versions, and there's some clinics in town. And I'm going to even put a plug in for Dr. Carter Moore, as a gynecologist in town. He sort of opened a clinic on the side, and he does see men, so the men can call and make an appointment with the gynecologist. But but it's effective. So I nearly universally endorse it for patients. They're not 100% effective for every single one, but pretty consistently it seems to help people, and they're mostly well tolerated. And I think they're safe, honestly.
When you think about the effects, overall health effects, on a variety of different things, that carrying too much weight, to the extent of maybe even being obese, has on the longevity of a person and all of the ancillary health issues that could develop, how in the world can insurance companies not support people going on something that's going to lose weight for them, because it's almost like a preventative thing for maybe some health issues they might have in 5, 10, 15 years?
Yeah, and I think for that reason you'll probably see legislation force their hand to stop putting weight loss treatments or weight loss medications in the category that they put cosmetic procedures, and which is saying, hey, that's unnecessary. And I agree with that sentiment. I think mainly the answer, though, is the question is because insurance companies are playing the short game, not the long game.
Yeah.
I think for companies that, and really it's interesting because the companies that seem to cover them are companies where there's probably less turnover and they have employees for years and decades, and so they do agree with that. But just for your average place that's switching insurance plans every year or two, because of the cost, I think they're less interested in that. So like Coca-Cola is a company that I have a few patients that have used, and it certainly seems like they do cover it. And there was a time when the teachers' insurance did cover it, and I'm not sure if it does now. It's hard to keep up with, honestly. But but I agree with that. I mean, there's no doubt. I mean, when those people who have benefited, not even the ones who lose 60 or 70 pounds, I mean, you lose 30 pounds, 40 pounds, it changes your physiology. And if you have mild high blood pressure, you probably no longer need medicine at that point. Or if you have, increase of blood sugar or mild diabetes, you probably are now controlling it with diet. So, weight, especially when you're losing fat, which is metabolically active in unhealthy ways, I mean, it really improves your health dramatically, and these people feel so much better. And so I'm a fan. I'm grateful we finally made some progress in this arena. We're all, just about everybody's guilty of the sin of gluttony when it comes to food. God made food good, and we don't know when to say when. And over time, it builds up, but it has profound negative effects on us, including so many cancers. Obesity is a risk factor for. So if we could lower the BMI of our nation by 5 points on average or something like that, we'd see longevity improve, quality of life improve, and so I'm grateful that there's something out there, and I think it's a step in the right direction for us to start maintaining and losing weight.
Dr. Craig DeLisi. Well, by the way, personally, my bouts with gluttony, I have an excuse. I do. That communication where, like, your brain is to listen to your stomach and your stomach to listen to your brain and all that. I'm a guy. I don't listen very well. Talk to my wife. I don't.
I like that
excuse. So, pile on more food on my plate. No, I'm kidding. Dr. Craig DeLisi with the Family Care Center, Titus Regional Medical Center. Healthier Tomorrow's Start.